look like paralyzed.
Gotcha. Welcome to the office. Welcome to the office. Nice to meet you. Hi.
Hello.
How's it going?
Good, how are you?
Welcome to the office. Welcome to the office. Talk to me. What are you guys doing here? How can I help you guys? You guys...
She is, about 2 months ago, she started feeling very tight in her neck and on her left side of the body.
2 months ago.
About 2 months ago.
What happened 2 months ago?
We just took a trip to India.
You went to India?
Yeah.
Went back to the motherland?
Exactly.
Okay.
And then I think 10 days after, she started feeling
While
this.
you were in India?
Yeah, while
Okay.
we were in India. Before, I mean, it was there, it was the stress part was there, her body was stiff, but it wasn't as bad. And
So
now,
she didn't have a cane before going to
she
India?
didn't.
She was mobile, she was moving around?
she did have a cane, but it wasn't where...
For what? What did she have a cane for? What was going on?
She had a knee surgery
Yeah,
done.
she had a knee surgery done before.
Left
Very
knee?
minor.
Just for the balance issue as well, you know. And
She
legs
had a
used to
fall
be-
before that, couple months ago
Okay.
at home, where one of these little chairs just slid back, and she fell
Fell how?
just
On
right
her
on her back.
Hit her head?
No,
Did you hit her?
No. She fell on her back?
yeah.
But it did hurt her in the back right here.
Injured her tailbone?
Yeah, I guess.
Okay.
She never got checked out for or anything like that. But
You?
then
Why?
after, it wasn't where it was, you know.
You had balance issues after that? Or you had balance issues
Before
before
that.
that?
Before
When did the balance issues start?
It's been there for a while.
After the car accident? Or before that?
It's important. Okay. Car accident was when?
2008.
2008. We're in 2022.
Yeah.
So she's had this stuff going on for a bit.
Yeah.
Okay. Any other injuries or accidents prior to 2008?
Prior to 2008, none, right?
No. One after that.
One more after
That
that. It was a
came on.
T-bone.
Madam, why are you getting into so many accidents? That's my question. Oh,
He's trying to kill her.
you still kept him? You still kept? So he's okay, but you got hurt?
Yes.
Sorry, madam, I don't want to make you laugh too much. Okay, all right. So 2008 was the first accident. Husband was driving. Her husband.
Yeah, we all were in the car actually, and then it was on a highway, it flipped.
Oh wow.
It was a rollover. She was in the last seat, so she wasn't wearing her seatbelt.
But
She had a contusion. Yeah, she had a contusion in her chest.
You got saved, man. And
Yeah.
the second one was a T-bone. These are two significant accidents.
Yeah.
Okay. And
God.
she saved you for a reason.
Yeah.
You know what the reason is?
You have to be here today.
That's why.
I don't know what the reason
I
is.
saw you very nice guy.
I'm usually a nice guy, but sometimes I'm not so nice.
Put my
Okay.
hand here, so I feel good.
Okay. I try to do my best for everybody, okay? And the idea when people are coming here is to hopefully give them an answer first what the issue is and see if we can help resolve, what their ailments are. And we'll see her for a couple of visits and we'll figure out what we can do.
She did have a couple more falls.
Okay?
This is
Hold
just
on,
weird.
let's go back to the T-bone. After the T-bone, she got treatment?
Knee.
Knee
After
surgery.
that, it was like, it wasn't a big knee surgery. It was just something small.
Arthroscopic, they cleaned it up?
I think so, right? Yeah, just something like
Okay,
that.
left side you said?
Right side. Left side's been hurting. Arthritis is what all the doctors say.
Okay.
But it's been hurting. She can't bend it all the way.
So the number one reason we're here is the back or the balance?
No, the numbness.
The numbness on the left side of the body.
Numbness meaning you have no feeling there?
I have feeling.
It's pins and needles?
Yes.
Buzzing?
Yeah.
Even her face. She feels it like half of her face or half
Not
of her
all
head.
the time. but
Her expression
there's
is low. Is this normal?
No, this is happening since 2 months.
So we have the numbness and pain in the left shoulder.
Yeah, so I think so. It starts here, basically this area,
Yeah.
and you know,
Next time is 3
and it gets very tight,
Tight, like it's a cramp.
like a muscle tightness. If you probably feel that right now.
मामा जैसे cramping होता है?
Let me see your hands. Hold that, please. Give me your hands. Relax them down. When you sit, you're okay to sit, or you need support in your back to sit?
It's
You need support. Does your back get tired when you sit for more than 10 minutes? You need to lie down then?
she can sit for long hours, Mama, but
How is the
But
heart? She's
standing.
had her heart checked?
You have everything.
Everything else is fine, heart is good, lungs are good?
Yeah, especially because of the left side. That's the first concern I have.
Absolutely. Well, their pulses are good. I'm checking 3 different pulses. Heart pulse is there, is good. Lung pulse is there, good, strong. Digestion is very weak, almost absent.
Now she had a problem with that for a while.
Okay. All right. So this is number 1. Number 2 is?
Number 2,
so she cannot walk for even walking to your office was a problem. So maybe like 2 minutes, I would say, not even 5. Her legs will start shaking. She won't need to sit down.
very weak.
Shaking, meaning you lose power, or dukawa, pain?
Like, wow.
Power nehe. Okay. So we gotta get the power on today.
One other thing is like recently they massaged her here. If you touch it, where you know put some pressure in the back of her knee,
Yeah.
that's when it triggers a lot more.
Of
Where
what? Yeah? Yeah, she has a posterior fibula. This triggers what?
it where the tightness will start coming, the weakness will
Like,
start shaking.
She
It'll
feels
get tight.
suffocated.
It'll get tight here. It'll get tight here. The whole left side start getting tight.
Mama, you explain what you feel. यहाँ पे भी हो जाता है बहुत टाइट ये भी पेट भी बहुत टाइट हो जाता है
The stomach is very bloated. Like you
अभी
can see
अभी
it.
भी देखो थोड़ा है
Tight.
हाँ
How many
No.
pounds have you gained in the last 6 months? 10, 20?
no
Last 6 months.
40 से भी ज़्यादा अच्छा
Oh wow, okay.
यहाँ पे ये जगह पे मुझे
किधर?
Wherever she's touching. Like that.
Ebo? किधर दुखता है? Here. Okay, so here, goes into here, goes into here, goes down into the hand here, into the arm.
Even like this.
Does it go into your hand here? Sub.
फिर हाँ फिर ये अंदर आम के अंदर भी जाता है और यहाँ भी ये फिर सारा ये स्टमक में भी पीठ में भी बहुत फिर मेरे से बैठना उठना कुछ भी नहीं
You're too young for all this. Okay, let's figure out what we can find, okay?
ऐसे हो जाता है कि बस ये जैसे look like paralyzed कोई कहता है
Can you raise your arm?
that's it
Down. Raise your right arm up.
right
Right.
one
Okay.
this is good
Okay. And down. Why don't you come on the other side for a second?
Sure.
Raise your left arm. Raise. Down. Raise your left arm again. Down. That's down. Raise your left arm again. There. Down. Raise your left arm.
यहाँ से आपने दबाया वहाँ दुखता है वो वाली ना
That's where it's hurting.
Yeah. But if I put my finger there, raise your left arm.
थम जहाँ पे आपका है
No. Raise your arm.
Raise it.
Down. Okay. All right. So what we need to do is this today. We're gonna go over the x-rays briefly with her. She's got a lot of stuff going on. The main thing is, because there's a lot of stuff, we need to figure out where we're gonna start today, okay? And we're gonna check the whole spine, like I said, figure out where the major nerve pressure is, and start the process today. When we're looking at the sacrum, we can see there was a tailbone injury, there was a fall. I don't know if that was the recent one or that was an older one yet. But what's happened is her tailbone has shifted back a little bit, and so has her L5. Her L5 is tilting back, so basically her 5 and her sacrum are shifted back together. You can see 4, 3, these are forward, correct?
Yes.
But it's not that we're adjusting a forward segment, we're adjusting the one below that's posterior, we're pushing that one forward. So there's a lot of pressure here in her L5 sacrum area, okay? Her disc is still decent, but it is pinching a little bit in the back here. Her L4 disc is great, her L3 disc is great. I am starting to see calcification of the abdominal aorta, so she's been eating, she's been eating well. Okay, she's been eating well. That could also, you see this line here, this tube coming down here? I don't know if you see it on this, you can see it on this X. You can see this almost a white tube coming down?
Yeah.
You see that?
Yeah.
That's the abdominal aorta. So if we're starting to see calcification of abdominal aorta, that could be affecting her circulation, separate from the nerve.
What exactly that means?
It means it limits the blood flow. It's like, you have the pipe,
Right.
and if the pipe is getting congested inside, just like the plumbing in your house,
Yeah.
then the flow doesn't go as much as it should.
Okay.
Okay, that's what I'm talking about. But that could also be a reason why she's getting that swelling. I don't know yet.
Okay.
But I'm just showing you some x-ray findings right now. So there is some of that going on there. Her 4 disc is good, her 3 disc is good, her 2 and 1, this starts to wear a little bit. But then you can see here, there's a tilt here. You see this, what I'm showing you?
Mm-hmm.
So this was some other trauma that happened. These discs are fine. She's had a lot of instability over the years, so we are seeing calcification. The bones are trying to fuse together. They're trying to stabilize instability. It's not the cause of the pain. It just tells me that there's been instability for a while. So when I'm looking here, C2 is tilted, 3 is tilted, 4 is tilted. C1 is riding up a little higher than normal. It should be a little more level. So the question is it C1 that's tilting up, or is it the occiput that's tilting back? And that we're going to find on her examination, okay? She has a lateral shift of her L4. She had a good fall. She had a really good fall. This is the pubic bone here. This is the crease of the bum. So her rotation is, the hip is rotating to the right side, okay? And what that's doing is, over the years, it's causing the right hip to wear out the socket. So this side is wearing out a little bit more than the left side. So this is wearing out a little bit more. This has been compensating the left side. And so what the body is doing, there's a little bit of calcification of the ligament in the left hip socket. And that's because the body is trying to stabilize. This is a rotated sacrum case. So again, I know it's fuzzy. There's extra weight on there when they were shooting the x-ray.
Yeah.
Okay, I can see what I need to see. But the main thing I'm seeing here is from 5, 4, 3, 2. These are all rotated. The bones are all rotated to her right side. So it's like the shift. This is her right pelvis. Her right pelvis is going to the right side. These bones, the sacrum, all of this is shifting with it like this. And then we're kinking right around 4, 3, 2, 1. Right here. So we're rotating this way, and then we're kinking like this. Okay? And so these muscles and ligaments have been out of balance for a while, and this is what I was talking about. Because there's been instability, from here, it's trying to fuse the area because of the instability. See?
Gotcha. Yep,
Okay?
makes sense.
And it goes all the way up. T1, T2, T3, T4. T4 is where the side slip starts. So T4 is shifting this way from right to left. And that's what's taking the spine up into the neck, which could be causing what she's having. T1 through 4 is also the heart and lung control, right? The neurological.
Yeah.
So 4 is what's catching my eye right now. T4. So we have a T4 potential. We definitely have a sacrum issue, tailbone issue.
Yeah.
The challenge is we got to get her on the table. That's fine. And I have to take 5 and 4 together, because if I have to take sacrum and 5 together. If 4 is shifted to the side, 5 and sacrum are both back like this. If I do just the sacrum, this is the challenge, this is the art, I guess. If I do just the sacrum, then this goes forward, this comes back, that goes forward. So it's a very different contact. It's going to be a little spicy. I'm just letting you know. It is a serious case. I'm seeing the T4 area, like I said. I'm seeing also down in the tailbone. That was probably where I would start with her.
Okay.
I will examine her. I'm not going to have her walk. There's no point in doing that right now.
Okay.
The main thing is we'll run the meter on the back. We'll do the static motion examination, and we'll get right to work. Okay, madam, ready? तैयार? हाँ जी. आया चलो. So I'm getting 10 points at C6, C7. There it is. 10 points, T4. But what's happened, actually, it's a little bit lower.
Do you see any inflammation?
That's what we're measuring. So that's exactly what the meter is measuring. It's measuring inflammation it's measuring the heat that's caused by the inflammation at the nerve roots. This is a bilateral temperature differential, and so when we're looking at the temperature of the paraspinals or the nerves, it should be equal temperature side to side. And so when we get pressure or irritation, we get inflammation. That's exactly what we're doing. And there it is, guys. It's starting down low, S3. And we got it up top, C1. C1, C6, C7, T4, S3. Those are the main issues I'm finding. So as I'm running my fingers down the spine, that's where the swelling is. Here too, but as we get here, you see it gets puffier. Either. 1, 2, 3. ये दुखता है? हाँ? 5 और 4. ये दुखता है ऊपर और नीचे?
नीचे.
5. 6. 7. 6 or 7. Back slowly towards me, all the way back. देखो, ये 5 है, ये 4 है. 4 or 5?
5.
1 or 2?
2.
3 or 2?
2.
S2. S2, T7. I'm not so excited about 7. I'm going up higher and I'll tell you why. 2, 3. 4 or 5? देखो. 4. I'm going with 4. 7 is fused to 8, so nothing's going to happen there.
I got you.
Okay? Ain't nothing going to happen there. I'm not going to put her in that pain. Sit back for me, please, man. नीचे दे. ऊपर. Six left. 6 right. 1. 2,
Oh.
3, 4,
Mm-hmm.
5. But here's the interesting part. Why that's hurting more when I laterally flex her, she's got that calcification of the thyroid cartilage. So it's a little misleading. And without an x-ray, you would sit here and feel it. Oh, it hurts. Oh, it feels stuck, and start cracking it. And if you look over here, this is a good case to explain. She's got calcification of the thyroid cartilage, and you can see it's more pronounced here on this side. So when I laterally flex her to the left side, it hurts, it's stiff. It doesn't mean you adjust it. Okay? Ick. And here's our test. Turn to the left. Bas. Turn to the right slowly. Good. Look up slowly. Turn right. This is the lower cervical. That's okay. Okay. Look down. Down and to the left. It's C1. So when we go down, we're isolating the upper cervical. When we're looking up, we're isolating the lower cervical. So I'm going for C1, the penthouse, and the basement. S2 and C1 is where we're going to start. Okay? Then I'll recheck everything and see what we need to do. We'll then probably adjust the shoulder last. C1. Go down. No. Gotcha. Hello? Hi? You're awake?
Yeah.
Okay. Look up. Look down. Look up. Look down. Look down and to the right. Look down and to the left. What? It's more, right? Raise your right hand first. Up. Down. Raise your left hand up.
Almost
That's it?
percent, yeah. I see the difference.
Nietzsche. Good. Move your fingers. Move your fingers. Zorti dab. Merahat. Zorti dab. Zor se dab. Okay. Good. Good. Let's recheck everything. C1 is clear. C6 is clear. No kidding, dude. T4 is clear.
Oh.
Shasha, what's going on here, dude? This was an upper cervical case. No kidding, dude.
That's clear.
Ma! Emma! Dekho!
Auntie.
Dekho! Different?
Okay.
L5. Dukawai?
Auntie.
S1. S2.
Auntie.
Same or less?
No.
Less.
Less ऊपर वाला less पीछे वाला.
Same.
Okay.
S2, same. L5 was a little less.
4, 3.
4,
4, 4, 5.
4.
S1, S2. It's moving better, dude.
Yeah.
Look, come back, come back.
Go back.
Come back. Well, I gotta get her down on that table. Can she go on her side? She's not gonna handle the side adjustment. I'm gonna loosen it up a little with the machine.
Okay.
I mean, you know what you want to do.
The major was C1. That cleared up the... Raise your hand again. I'm straight forward. It's gonna keep moving. Just bring her forward. Bring her forward on the table. Bring her forward. The front is soft. Just breathe. Breathe, madam. Breathe. Okay, cover yourself up. Okay. I'm gonna use the board for her to start, okay? Oh, wow, madam, you're gonna make me go. Come on. You gotta help. We gotta lift her up. You gotta slide her up. Hold from underneath the knee here and underneath the thigh here.
Hi.
Yeah, and let's go up, upper, bas. Good. You stay nearby. You stay nearby. Okay, that's two. There you go. Good. 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 That's two. Good. Little bit less. Less. Okay, let's lift her up. Come on the side, help her. Make sure your legs are planted, madam. Deep. Help her off the table, help her, both sides.
You still like him?
I was being nice, dude, what are you talking about? Give her a second. Help her, don't let her be by herself. Step back from the table.
Can you run it?
Yeah.
And bring her back here. Have a seat. I'm gonna set her shoulders. Good. Nice. Right side. Nice. Left side. Nice. Okay. I'm gonna let her relax for just a couple of minutes, then we'll recheck, okay? We got the pressure off the nerve, okay? And that's where we're gonna start. We got a little bit of work, and you know, we'll get through it. And as long as you can go face down, we're gonna do better work for you there, okay? So your job is very simple. I don't wanna mess with anything else right now. We gotta get the power on first. I start whacking extremities on her, it's not a good thing.
Okay.
Let's see, like I said, we have to start somewhere.
Yeah.
Right.
I will follow up with you on Friday, okay? And then we'll see for Monday and Tuesday, and then we'll make some decisions. Fair enough?
Absolutely.
Okay, madam?
Sounds good. Thank you so much.
You're welcome to the office.